Okay, good day, everyone. My name is Sofian Imansa. In this session, we would like to share about COVID-19 prevention. Yeah, before we start, let me introduce my team. I myself, Sofian Imansa, and then Yulia, Safa Nadia, and Zafina Zuherni. And then this is our agenda today. Uh, First, what is COVID-19? Second, number of cases. Third, symptoms of COVID-19. Fourth, how to prevent COVID-19 effectively. And fifth, conclusions. Okay, let's begin with this video. We will know what is coronavirus like.
So the whole family of coronaviruses are named coronavirus because corona means crown. And so this refers to the way that the virus looks under the microscope, like there's a crown on the top of the virus. Some of them, 4 or 5 different kinds, cause common diseases among humans. Everything from the common cold to mild or moderate respiratory illnesses. Other kinds of coronaviruses affect animals. And sometimes, on rare occasions, we see coronaviruses jump from animal species into the population. The 2019 novel coronavirus is getting a lot of attention now because it is a new kind of coronavirus we haven't seen among humans before. The theory is that it may have jumped from an animal species into the human population and then begun spreading. We have seen some people that have died of this disease, and we know that there are already thousands of cases. So people are concerned because we don't yet know exactly how severe the disease will be or how far it will spread. When a new virus emerges, we often have to learn much more about it. And one of the things that we question is, how does it transmit from person to person? We know that most respiratory viruses are spread by large droplets that come out when people cough and sneeze and stay aloft usually for about 6 feet in front of them. They land on surfaces and then can also be transmitted between person to person by touching those surfaces, such as doorknobs or other surfaces. Other viruses can spread in the air and stay aloft for a longer period of time in small droplet nuclei. For this current 2019 coronavirus, we're not yet sure whether it is droplet or airborne transmission. So we're erring on the side of caution and taking protection as if it was spread by the airborne route. We're still learning a lot about this 2019 novel coronavirus to understand how dangerous it might be. Right now, the majority of the cases are in China. We know that some travelers have brought the virus to other countries, including the United States. I think one of the main things to keep in mind is that this is respiratory virus season, and we have other respiratory viruses like influenza that we need to take precautions because we know we have thousands of cases and thousands of deaths in this country every year from influenza. Given the ongoing transmission of the virus in China, we have a travel alert that was issued by the Centers for Disease Control and Prevention. So at this time, until we know more, avoid non-essential travel to China. Johns Hopkins Health System and health systems across the nation are busy right now preparing to safely identify, isolate, evaluate, and care for patients with the 2019 novel coronavirus. We have the capability of doing this safely by utilizing personal protective equipment, by implementing travel screening so that we can quickly identify patients who have risk factors for the disease, and then implementing isolation precautions, the use of personal protective equipment, and other measures to make sure that we limit the spread of the virus. At the Johns Hopkins Hospital and throughout our health system, we routinely care for patients infected with diseases that are spread by the airborne route. So we have expertise to do this safely. When a new virus comes along that has unknown risks, we have extra measures that we can put in place, including our biocontainment unit that can advise us and put plans in place to safely care for these patients.
Okay, according to the previous video, coronavirus are a large family viruses that causes disease in humans and animals. In humans, it usually causes respiratory tract infection, ranging from the common cold to serious illness such as Middle East Respiratory Syndrome or in MERS and several acute respiratory syndrome or SARS. A new type of coronavirus found in humans since an extraordinary event appeared in Wuhan, China in December 2019. Was later named several acute respiratory syndrome coronavirus 2 or SARS-CoV-2 and caused coronavirus disease 2019 or COVID-19. Okay, this is your turn, please.
Thank you, Mr. Sofian. I will continue from Mr. Sofian. How do humans get infected COVID-19? A person can be infected by someone with COVID-19. This disease can be spread through small droplets from the nose or mouth when coughing or sneezing. The next slide, please. So we can see the number of cases in global. There are 201 countries and then infected around 171 billion. And then that's there are 3 billion, there are around 3 billion. And then the last update around 4 July 2021. And then we can see the number of cases in Indonesia. In fact, there are 2 billion infected, and then recovery around 1 billion, and then that's around 60
Thousands.
60.5 60.582, and then the last update is about around July 2021. Okay, I will continue to Miss Zafian.
Safa, okay. Your turn, please.
Okay, the symptoms COVID-19 is like cold, fever, shortness of breath, and then sore throat. Next part. How to prevent them? We can wash your hand, wear a mask, avoid crowded, no shake hands, and stay at home.
Okay, Vina, your turn.
Okay, so the conclusion is currently the spread of COVID-19 is increasing, so everyone should be advised to stay at home, love yourself and your family. If you have to leave the house, follow the health protocol strictly. If there are symptoms of COVID-19, such as fever, cough, sore throat, loss of smell, then immediately consult the nurse doctor.
Okay, thank you for listening and nice attention. That's all our presentations. And see you next time and bye.